Health IQ Podcast. Connecting the dots, shingles, and shots save. Ever heard of shingles? It's a painful condition linked to chickenpox, but there's good news. A vaccine can protect you. Tune in to learn more.
Welcome back to this episode of Health IQ. Today we will be visiting about a topic that will be important to our newer parents and our senior citizens. Joining me today is Lindsay Faust, a certified nurse practitioner with Presbyterian Medical Group. And our crew today is Joyce Runyon and Bobby Hockaday, and I am Brenda Bishop. Lindsay, thank you for coming today. Last year I had many friends and people I saw talking on Facebook about the pain they were in from shingles. And so I thought this would be a good thing to talk about this time of year because it's one of those things that we know very little about, but can be prevented. So I thought first we'd talk a little bit about what the signs are. And I guess my husband had shingles last year, and we didn't even know that that's what they were until he's like, I got to go to the doctor. We were thinking it's something else. So what are some of the signs we look for shingles?
So one of the first things is severe pain. You don't always see the rash right away, but you're having this severe pain. And sometimes it can be mild, like a little numbness, tingling, prickly sensation. You may run low-grade fever, feel a little bit flu-like symptoms. That can be that prodrome period. You have 1 to 2 days before the rash actually appears. Did your husband develop a rash with it?
Yes, it was in his head, and so we thought it was something else.
And so, oftentimes you can kind of get little subtle symptoms. So like a cold sore where you get a little numbness, tingling before you get that cold sore. Shingles can present kind of like that. So,
well, and I guess now you mentioned cold sores, that's sort of the same virus type family that would cause both of that. So those are some of the signs, but can you just take care of them at home, or what should you do?
So there is an antiviral medication that can help shorten the duration of the illness and can help prevent kind of long-term side effects. And so I encourage patients, if you feel like you may have shingles, go be evaluated, check in with your PCP. The sooner you can start an antiviral, the better. So really the antiviral medication, valaciclovir or acyclovir, it's recommended within the first 3 days of symptom onset, which can be kind of tricky because you don't always get that rash in that first 3 days.
So what happens if it's past the 3 days? Can you still have the viral medicine?
You can. It's just less likely to be as effective.
So is it contagious? Are there things we need to do to keep it from spreading to the parts of our body?
So the way we pick up the shingles virus, or we develop the case of shingles, is actually from chickenpox. And I know we'll get into that here in just a little bit. But that virus lies dormant in our system. And then we have some type of aggravating factor, whether it's stress or just some decreased immunity. And that can cause that virus to present and come out as shingles. And so oftentimes, patients will develop, like we talked about, that severe pain. And again, I encourage you, if you feel like you may have shingles, check in with your PCP and be evaluated.
And how long does it usually last?
So shingles can last, the rash itself can last up to 2 weeks. If you start the antiviral medication, that may be shortened a little bit, maybe 5-7 days. Sometimes symptoms of shingles, that nerve pain, I've seen it last upwards of 18 months.
I know my husband, he kept saying, check my head, is it coming back? Because he kept having that stabbing pain.
Even after that rash clears, you can be left with that nerve pain that can be just persistent, aggravating, and debilitating to the point where patients feel like, they feel like they're being judged kind of as not able to handle what they're going through because there's nothing obvious to be seen, so like there's no rash, and so people are like, oh, you shouldn't be in pain anymore. But that nerve pain, you can't see it, but it's there, and it's very debilitating.
And I recognize nerve pain from having a severe injury and suffering over a year with nerve pain.
Yeah.
So you talked about weakened immune systems might make it come back up. So things we could do to keep our immune system, and then maybe if we try to manage our stress, will that help prevent?
Absolutely. There are risk factors that we can't modify, such as our age, and as we get older, that immune system naturally weakens a little bit. And so, but if we can take measures to try to decrease our stress, try to protect our immune system, those are things that can prevent
eating healthy and all that kind of stuff.
Correct.
Getting plenty of fruits and vegetables.
Exercise, good sleep. Yeah.
All those things that we know we should do that we don't always do.
Yeah.
So I know that I see commercials about the vaccine. So can you tell us about the vaccine and how the process works for that vaccine?
Okay, good, yeah. Are you aware that there's 2 different vaccines?
I was not.
So in 2006, there's Zostavax vaccine for shingles, a live attenuated vaccine. Efficacy of it wasn't that great. I think it was only like a 50% efficacy. And so in 2017, they came out with a new vaccine called Shingrix, and that's what's available today in the U.S. And so if you were vaccinated before 2017 for shingles, it's still recommended that you get revaccinated with Shingrix.
That's something we need to make sure we're letting people know.
Yeah. And so it's FDA approved starting at age 50. So if you do get a case of shingles, say at 45, 48, 49, you can't get that shingles vaccine until you turn 50. It is a 2-dose series, so you'll get 1 shot, and then recommended 2 to 6 months after that, you get your 2nd dose. And then there's no re-immunization that's required. That 2-dose series, you're considered complete.
Now, there are some people who have like autoimmune diseases that actually have to get that at younger ages. Correct?
From my understanding, age 50. That's the
50.
earliest that you can start getting the Shingrix vaccine.
Wow. So I'm trying to think back. I've had mine, but I may have gotten the other one.
Was it before 2017?
I don't remember.
You may want to check.
I'll have to count back. And I was very happy to get mine, though it was a process at that time to get it, because you had to make an appointment to get the shot with a nurse, but you had to go get it from the pharmacy and race it over there.
Yeah.
Is that still the same kind of process?
So the clinic that I work at, PMG Clinic, that is still our process through PMG Clinic. We put the order in, it gets sent to pharmacy. You pick it up from pharmacy, bring it in for a nurse visit administration. As of about 2 to 3 months ago, our local pharmacy started offering the Shingrix vaccine. So I was very excited for that. So I tell patients, if you prefer, just go to pharmacy. Carlos over there can administer the Shingrix vaccine, so he can order it, administer it, and then you'll just return there for your 2 to 6 month 2nd dose.
And do they need a prescription to do that if they're going to get it at the pharmacy?
No, Carlos can order it.
Oh, that is so convenient.
So it's a really good resource for the community. Absolutely.
I know my parents told me years ago that they had gotten it at their pharmacy there in Albuquerque, which is, a bigger pharmacy.
Yeah.
So.
And other retail pharmacies should offer it as well. So if you're, in Clovis or Amarillo and you want to go to Walgreens, Amarillo with CVS, Walmart, they should offer it as well.
So just as a reminder, if you recently had shingles, how long do you need to wait or will you get shingles again if you've had it?
You are at risk because that virus lies dormant in your system. You are at risk of having a reoccurrence of shingles, and it could possibly be in a different location from where you previously have had it. Guidelines recommend waiting at least a minimum of 90 days after you've had an active case before you can be vaccinated for it. And again, after age 50.
So that's good to know too. Because I do know people who've had it even at younger ages, but they didn't know they could get the vaccine. So you mentioned the chickenpox and how it's related. So you want to give us a few more details on how that's related?
Yeah. So I know in our younger ages, most of us either have had chickenpox or, pretty much all of us have had chickenpox.
Yes.
In 1995, they came out with the varicella vaccine, which is a chickenpox vaccine that became mandated for our pediatric patients to start being vaccinated with them. Prior to that vaccine, The only way we would develop immunity to chickenpox would be an active case of it. And so that kind of itchy, vesicular type rash that would last, 5 to 10 days. But then after that, typically recovery, and then we have some immunity, but that virus still lies dormant in our system. And then as we get older, it can flare up, causing the shingles. Yeah.
I was one of those few people who have actually had chickenpox more than once. And that second case was so severe that as soon as I was eligible for that vaccine, I got it because I didn't want to go through that again. So you sort of talked about what it does in our bodies. And so can you tell why, because parents are so hesitant anymore about getting vaccinated with any of the vaccines, even though they've been around a long time. Can you tell us how you or what you do to try to convince parents of its importance?
So the varicella vaccine is recommended at age 12 months. And then a second dose at 4 years of age. And that's with our typical immunization schedule currently. And so any patient who's in the public school system, of course, those vaccines are required. Again, when you get chickenpox, it can be like you had in your second case, but a very severe case, very uncomfortable, can be associated with fever. What we get concerned about is secondary infections with pneumonia, brain inflammation. And so, having a vaccine to prevent that has been a real big improvement for the healthcare system.
Well, and I was surprised when I was looking up some information about chickenpox that people actually died from chickenpox. We know that a lot of people died from like smallpox, and that's one of the main reasons they worked so hard to get that vaccine. But that was probably one of the reasons they worked hard to get this vaccine too.
Yeah, and severe complications from chickenpox is rare in a relatively healthy individual, but patients who do have immunodeficiencies or immunocompromise definitely increase risk. And that's another good point about a lot of our vaccines protect us as individuals, but with that herd immunity, we're protecting the more vulnerable population as well. And so
I was just thinking of that when you mentioned that. So if for some reason as a toddler and 4-year-old you didn't get the vaccine, can you get it later?
Yes, there is an updated immunization schedule, and so I would just encourage you to talk to your PCP, your pediatrician, and they can offer that updated kind of delayed immunization schedule. If you have history of an active case of chickenpox, it's not recommended that you get the vaccine at that point. And the main reason is because the virus is already in your system. A vaccine's not going to change anything.
So we don't want to get it if we've had
If you've had an active case of chickenpox, yes, you don't want to get vaccinated.
So the other question I was thinking of and I couldn't find this information, if our children are vaccinated, then will shingles sort of go away as our children get to be 50?
So the research right now is showing that with the chickenpox vaccine, and so the varicella, we mentioned it's a live attenuated vaccine. So live attenuated vaccines, we're putting a little bit of that virus particle into the system. And so that virus is in the immune system. And so the answer is yes, they can still get shingles as they get older because that virus is present. Studies are showing that breakout of shingles as they get older is supposed to be less likely. I think I saw studies showing 78% decrease in shingles for those who have been vaccinated against chickenpox.
Oh, wow.
But it is still recommended once they turn 50, they receive the Shingrix vaccine.
And I guess because it was probably tested quite a while that there's probably kids getting close, or adults getting close to 50 that were some of those first vaccinated.
Yeah.
Yeah, my daughter I don't think was, but but my son I remember was being vaccinated against chickenpox, so it was right about that time. Yeah. So I did find a chart that I thought was sort of interesting. That was before the they started, not after the vaccine was invented, but before they, approved it to be mass given out or whatever, that before 1996, more than 4 million cases of chickenpox occurred. More than 10,000 were hospitalized and up to 50 deaths. So I was like, wow. And now, to show how well this is working, and this I think is worldwide, though it did come from the CDC, there are fewer than 150,000 cases, fewer than 1,400 hospitalizations, and less than 30 deaths. Mm-hmm. So I was like, that is a really big change. And but for me as a mom, it was like, oh yeah, I don't have to worry about taking off work to be with the sick kid as it circulates through school. Mm-hmm. They don't have to miss school and all those kinds of things as well for getting that vaccine.
And just a little side note that we didn't touch on is that the chickenpox virus, the same thing as the shingles virus, very, very contagious. And so drop contact precautions. So it's spread by droplets and airborne. Right. And so that's what makes it so contagious. And before the vaccine among kids, just being in the same room, that virus in air particles could make you sick. And so, we briefly talked about earlier how, is shingles contagious? And the answer to that is yes. If there's like an open vesicle that's oozing, that liquid is contagious if you come into contact with that. And not only to touch contact, but air droplets as well. And so there are populations who are at increased risk to exposure to somebody with an active case of shingles. So our pregnant patients, they don't want to be exposed to somebody with shingles. So if you have shingles or you know somebody who has shingles and you're pregnant or know somebody pregnant, you want to avoid them until the rash crusts over. Other vulnerable populations are going to be our newborns, our pediatric patients who haven't been vaccinated with the varicella yet. And so just good precautions to take for active shingles.
Oh, yes. Yeah. Something we probably should make a post about that as well. To get out that message out there too. I was just like, oh my, stay away. but I didn't know. So
and I'll oftentimes have patients ask me, so they'll come in with their spouse and the spouse has shingles and they're like, oh, am I going to get this? Like, do I need to stay away? And, it's unlikely that you will get it, but it's important that the person who has shingles, that they're keeping, if they have the vesicular rash, they're keeping it lightly covered just to avoid that exposure.
So this has been interesting, and I hope people are paying attention. And if you're over 50, you go out and get that shingles vaccine. But also, if you have young children, that you're getting them vaccinated as well. And so I thought, as we end with some of this, that our food for thought quote was, in 1990, 1 in 10 children died before the age of 5. This would be worldwide, but that's a lot of children. That's down now to 1 in 20, and vaccines were the single biggest factor in that. Had it stayed at 10%, 122 million more children would have died. And that's from Bill Gates, and their foundation's very big on vaccinations. But I thought that is, a real testament to the importance of our childhood vaccines.
Yeah, I agree.
Well, and one thing we didn't say is all of our children's vaccines are free in the state of New Mexico, so you don't have any cost to those. And I assume most insurance and probably Medicare pay for the shingles.
Correct, yeah.
So
I tell my patients when we talk about immunizations and we talk about the Shingrix vaccine that it's 100% covered by insurance because it's a preventative service. So, and then with the varicella, the chickenpox vaccine, it's included in with those regular well child check immunizations that are offered. So
that's a wonderful little benefit to all of us, right? So we do have a gift for you. We want to thank you for coming back a second time to our thing.
Thank you for having me.
A nice little cell phone holder for you.
Thank you.
With our logo.
Thank you.
And we want to thank you for joining us again. And I'm sure we'll ask you to come back for another topic sometime, or if you have one that you would like to get the word out about, let us know. And
that sounds good. Thank you.
And with that, we want to thank all of you for joining us for this episode. Be sure to come back next time as we have a topic planned for you to help you during this busy season.
Special thanks to our guest contributors for this episode: Lindsay Faust, family nurse practitioner, BC Presbyterian Medical Group. Our host for this episode was Brenda Bishop, Quay County Health Council Coordinator. Cool thanks to Gordon Runyon, our locations manager, for keeping us chill. Health IQ podcast crew. Our director was Robert F. Hockaday. Our producers are Robert F. Hockaday and Joyce Runyon. Our camera operator, Robert F. Hockaday. Our second camera assistant, Joyce Runyon. This episode was edited by Robert F. Hockaday. Music was provided by David Morris. Funding for Health IQ provided by a New Mexico Better Together grant, brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email, healthikpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, QCHEALTHCO.uncil.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.